Well, I want to find out something about fistulas. I heard you mention them a couple of weeks ago, and I don't know whether I have my. I get these little puffs of gas when I'm going, when I'm urinating.
When you're peeing? Okay, sure enough. Okay, that's exactly what happens when you have a fistula, which is an abnormal communication. In your case, between the rectum and the urethra or the bladder, and more than likely the bladder. And so what happens is that, gas will move from areas of higher pressure to low, very much like what the weather does. Things cool off outside because all of a sudden, there's a low pressure that rolls through. Okay, so it doesn't rain because the pressure changes. It rains because the temperature drops. Well, the gas will move because of pressure differential. So when you're going to the bathroom and bearing down, the gas will move from an area of compressibility to an area where it can go through at low pressure. In this case, it would be the bladder. When this happens, okay, it can be a real problem because you can introduce infection from the rectum into the bladder on a continuous basis, okay, and it can lead to urinary tract infections, which for the most part are a bit of a nuisance for most people, but they can become life-threatening if you have an immune system compromise or if it hits you at just the wrong time, like if you're going in for a knee replacement or if you're going in for a hip replacement or even if you're having dental prostheses put in. So if you're going to pee and you're seeing gas bubbles come through, you need to what's the word? You need to hurry on down to your local gynecologist, okay, and suggest that you might need to be worked up for a rectovesicular, that's spelled V-E-S-I-C-U-L-A-R, fistula, because it's something that does need to be mended. The urologist can do it, but really your best bet is a gynecologist for the most part. At least that's been my general experience with it. Selene, does that answer your question?
Is this serious?
Yeah, it's serious. Okay, the body is set up to keep certain places pretty well isolated, and the lower GI tract is one of those places that you really don't want to mess with. Okay, when you were a kid, they taught you basic hygiene and so on and so forth, where you move the tissue paper from front to back, not from back to front as a chick, right? Okay, guys don't have to be doing too much of that. Unless they're changing diapers, okay? But the problem is that you're moving that piece of toilet paper without having to move anything at all. If you're introducing infection into the bladder on a continual basis or on an intermittent basis, it can cost you a great deal of aggravation and morbidity. So the answer is yes, it is serious. Yes, it is something that needs to be dealt with. I'm hoping that that's not what they're going to find, but they're not always so easy to find when they are there. So you need to have somebody who's experienced with it. If it's a GYN urologist, that would be fine. Okay, somebody that's boarded in both or experienced in both. But Selene, my friend, that is exactly what you need to do.